So joining us now for more on this is Dr. Celine Gounder. She is the editor-at-large for public health at Kaiser Health News and an infectious disease specialist and epidemiologist at NYU Grossman School of Medicine and Bellevue Hospital. So happy to have you here. Listen, if you didn't believe that there was a surge happening, now we have the President of the United States, one of probably taking the most precautions that you can take, but you gotta live your life, and he comes down with it. I want to give people a sense of just where we are in the country, and you can talk about what we're seeing right now. This is a look at sort of where the high points are and the low points are when it comes to COVID, the orange being the highest percentage. This is according to the CDC. So they're looking at cases, but they're also looking at hospitalizations. What do you see here?
Well, they're looking at hospitalizations, and they're also looking at what is the hospital bed capacity. So you're going to see in rural areas that are really seeing a big surge in COVID, those areas like in here and in here in the Midwest and the West and the South, where you also have less hospital capacity. So if they have somebody who does end up being really sick, you're less likely to have an ICU bed. In general, we know that vaccination rates up here in the Northeast are the highest in the country, so not surprising. It's very low risk. And then also up here in the upper Midwest, Minnesota has very high vaccination rates. But this part of the country here in the Southeast, over here, Western and California as well, we're seeing a lot of transmission.
So how much of this, though, is a guesstimation? Because, a lot of people are testing, they're not reporting whether they test positive or negative, or they're not testing at all. So could this actually be worse than it looks on the map?
We certainly have more cases than you see on the map. The other way to sort of measure this is sewage testing. So we can test how much of the virus is in the sewage. And we have seen, for example, in LA County or San Francisco, those levels go sky high. So we know that there's a lot of transmission occurring. I think the key message is, especially in places that have very high vaccination rates, you're not seeing a lot of people end up in the hospital or getting severely ill.
And speaking of that, which you would call sort of the silver lining, is that when we look at deaths, at least we see that they're nowhere near as high as they were before in our previous surges. Let's talk about some of the factors that's contributing to that.
Vaccination.
Right.
And actually, if you compare, no one has really been unexposed to COVID at this point. Most people either have immunity from the vaccination or immunity to some degree from prior infection. But there's clearly a difference, because if you look at counties where the vaccination rates are much lower, say 30 to 60% fully vaccinated, you are seeing those cases, those hospitalizations go up much more in those counties than counties where vaccination rates are much higher. So vaccines definitely protect you better against that severe disease, hospitalization, and death.
So the president is isolating. He's also taking Paxlovid. But I remember you telling me about these new variants, and that when you look at them under the microscope, some of them, they don't even look anything close to the original COVID. So how effective is Paxlovid when it comes to these new variants?
It's a really good question, but the part of the virus that Paxlovid is targeting is not the spike protein. It's an enzyme that's used to in the viral replication when it's making more of itself. And so it's blocking the virus from making more of itself. The drugs that are impacted by these mutations and the spike protein, these new variants, that would be the monoclonal antibodies. So some of those have stopped working because of the emergence of new variants, but Paxlovid will still work just fine.
Before I let you go, I want to ask you about something completely different, not COVID. While we're dealing with a novel virus, there's an old virus that may have sort of reared its ugly head, polio. There's a confirmed case of polio here in the U.S. It's been years since that's happened. This is an individual that had not traveled outside of the country. What do we know about that case? Unvaccinated.
Right. So this person seems to have picked up a vaccine-derived strain of polio. So this can happen when, and we use oral vaccines in most of the rest of the world. If you imagine trying to do a mass vaccination for polio, drops in the mouth is a lot easier than having to use a needle for everybody. And so that's what they use in many other parts of the world. And the issue with that is that virus, it's a live virus. If it does spread in a community, it can mutate back to its original form, which is what seems to have happened here. So why did it have the opportunity to spread and mutate back? That's because the vaccination rates in Rockland County are much lower. So only 60% of their 2-year-olds are vaccinated against polio. And so it means you have this opportunity for something like this to happen.
That is so interesting. Dr. Celine Gounder, I always learn something when you come by. Thank you so much.
My pleasure.